important event to talk about issues so basic and yet so profound around food insecurity and its impact of residents on the west side of Chicago. I have some quick housekeeping rules.
Wow.
You have a sheet at your seat that has information on accessing our Spanish language translation. Please keep your phones on mute, but you can use that sheet in order to get that translation services. Second, we have Spanish language, we have sign language interpretation located here to my right. Thank you for standing. The sheet also shows you how to ask a question of the panelists throughout this evening. You are encouraged to submit questions throughout the panel discussion, not just at the end, so feel free to submit your questions throughout the event. For those of you posting to social media about tonight's event, we welcome you and encourage you to use the hashtag Wellness West Chicago. Again, that hashtag is Wellness West Chicago. We are so honored today to have so many people here. There are several folks from the Illinois Healthcare the Illinois Healthcare Transformation Collaborative. And at this brief moment, I would like to recognize those individuals. So Jesse Laboy, you are actually already standing up. So I'd like to welcome you here today. Thank you on behalf of the director for being here today with us. Next, I would like to bring to the stage our chair and our vice chair of the Wellness West Board of Directors, Mr. Jose Sanchez. He is the CEO of Humboldt Park Health, and Donald Dew. He is the CEO of Habilitative Systems.
Okay, good evening, everyone. Thank you for joining us this evening. As Misty said, I am Jose Sanchez. I am the President and CEO of Humboldt Park Health, but I also have the privilege to work with an incredible board for the Wellness West. For those of you who don't know me, I am not from here, but I am from here. So about 14 years ago, actually yesterday, I came to Chicago from New York to take the responsibility of getting a failing hospital on the west side. At that time, it was called Norwegian American Hospital. Today it's called Humboldt Park. It was a 3-year engagement, and I now have been here for 14 years. The passion that I had for the work that I found have kept me here, although I thought that I will never go back to New York. I'm here. I am from here. I am from the community. And actually, this has been the most remarkable time in my career, having been in healthcare for over 40 years. So, about 3 years ago, we had an opportunity to actually participate in a transformation grant by HFS, and Jesse, thank you again for the extension of the additional 2 years to continue our work, which was begin actually in 2025. But I have been able to work with incredible and remarkable leaders that actually have a passion for the work that they do to transform healthcare on the west side of the city. I also had the privilege to work with an incredible board that actually is so dedicated to the work that we are doing. And with that, I want the members of the board to actually stand up. We have one standing up here. Daniel Du, Tesa, can you stand up the way people see you? Thank you. And any other board member? I got Dr. David Ansel all the way in the back. How could you miss that gentleman here? David. Actually, by the way, David was the one who got me to take this role 3 years ago when we were applying for the grant, and I was putting my own group, and then he says, you should join our group. So, he convinced me, and here I am having a lot of fun. I also want to thank the providers. All of you are doing the work every single day, who make a difference in our community. I also want to take this opportunity to thank the community health workers that actually have been doing the work, who make it a difference in our community. I want to say thank you to the leadership of Misty, who is here. Misty is our executive director, and she has an amazing group of staff that produces results every single day. And we are here because of the work that they do. So they make this board and all of us great. We are very proud to know that I'm always in competition, but our Wellness West is a superstar when it comes to transformational healthcare. And the level of collaboration and results and outcome that we have had is just incredible. For the last 3 years, I also had the privilege to work with someone very special who have been my friend and colleague, and I consider to be like a family to me. We actually talk almost every day, but every Monday at 8 o'clock, we have a conversation with Misty and other members of the board. And I go and I look for his advice from time to time. And, I actually found a family here with all of you, but also with my brother, Daniel too. So welcome, Daniel, to Ogden.
Thank you so much, Jose, my brother, my friend, my colleague, and my brother from another mother, as we always say. Again, my name is Don Dew. I'm president and CEO of Depository Systems, Inc., and I've actually been employed at HSI for 40 years and had the pleasure of serving as a CEO for 34 years. And if I may have just another moment of personal indulgence, this month, many, many decades ago, I was born at Cook County Hospital on the west side of Chicago. So needless to say, my heart is in the west side. And my heart is also with this collaborative. Because as Jose has already articulated, we've come together with a group of leaders who are making a powerful difference in this west side, in the 6 rather than the 10 distinct zip codes that we have been charged to serve. So again, I want to say thank you so much, and thank you to everyone who's here tonight, because clearly your presence serves as a real statement. Your presence means that you care about the West Side community. Your presence means that you care about our brothers and sisters who are marginalized and who are disenfranchised and going through some level of pain and struggle every day. Some of you all may have heard Kendrick Lamar's song that references grief when he says that everybody grieves differently. Well, we know there's a lot of grief, a lot of pain, a lot of trauma, a lot of suffering on the west side of Chicago. We also realize that your presence here tonight is a statement that you want to be a part of the solution to that most basic human right, food insecurity, or rather food security. And we're here tonight, of course, to address the issue of food insecurity. Dr. King once said, why should there be hunger and deprivation in any land, in any city, at any table, when we have the resources to provide the basic necessities of life? You know, Martin Luther King also said that we have to have a fierce urgency of now. And I commit and submit to you this evening that we at Wellness West do have a fierce urgency of now, and we've come together in a powerful way to really deal with this urgent need in the West Side communities. So this is a question we are here tonight to ask and hopefully provide some answers to. How is it possible that fresh, nutritious food is plentiful in some areas of Chicago, but scarce in others, like the West Side? How is it possible that in this, the greatest city in the greatest country, a child will go to bed hungry tonight? And I must also say that, you know, when a child cries, we see no color, we see no religion. When a child laughs, we see no color, we see no religion. So let's keep our children smiling and laughing and put some food, nutritious food, in their stomachs tonight. Solutions to the hardest challenges of our society begin just like this, by people like you, coming into rooms like these, all over the city, all over the country, really saying, you know, how do we solve and be a part of the solution and address the most urgent needs of today? I've often said that, you know, we have all been, on some level or another, students of history. And we've seen great things happen by great people. But the reality of the situation today, tonight, is that it's our turn. This is our watch. The question is, what are we going to do with our time? What are we going to do in this moment to make a difference? Thank you so much.
Donald, when you were quoting Kendrick Lamar, weren't you about to say they're not like us? Because that's true too. That's true too. Well, next I would like to bring up Jesse Lava to the stage again. He is the assistant to the director of HFS. So please join me in welcoming Jesse Lava.
Hey folks, so we have the honor at HFS of funding and running the Healthcare Transformation Collaborative Program. If you don't know much about it, there are 15 such collaboratives across the state, and what we are doing is trying to break down silos. We could always invest in a hospital to expand one thing. We could invest in a child care center to expand another thing. But we are investing in networks. And you guys have 40 organizations coming together. And without them, you could not do what you do. So if we're going to do a King, I'll call it an audible. If we're going to do a Dr. King quote, we're investing in the web of mutuality to which we all belong. So I thank you all. And since I'm at the state representing Governor Pritzker and our director, Lizzie Whitehorn, I want to recognize Senator Omar Aquino and Representative Camille Lilly for their work in making the Healthcare Transformation Collaborative possible. Without them, they're not here, I'm not here. And the Black Caucus, the Latino Caucus as well. So thank you all. Misty.
I do want to also just acknowledge we do have some elected officials with us now and some that are joining later. So Representative Lilly, thank you for being here today with us. It's a pleasure to have you. All right, so I'm going to move us along. So you guys have already heard the innovative partnership where we are bringing together members from various different organizations, hospitals, FQHCs, other community health centers, community-based organizations, and community mental health centers. And I'm so thrilled to be working with these providers, over 40, that are really dedicated to not only addressing healthcare, like what happens in their exam room, what happens in their treatment room, but also to think about addressing things that happen outside of the exam room. So social drivers of health influence health outcomes at 50%. And what my doctor, and I think I've said this multiple times, right? When your doctor tells you to do, take insulin, that really only contributes to health outcomes at 20%. So it's really important to have a holistic perspective in terms of how we address healthcare. And this is really what this collaborative is all about. And so what we have found, and as we've been working with folks on the West Side, is that 82% of our participants have a social drivers that impact their ability to have the best outcome possible. Of that 82%, 8 out of 10 individuals have one SDOH, social drivers of health need, whether that's food insecurity, which we're going to talk a lot about today, housing, which we talked a lot about last year, access to transportation, financial stability. Those just name a few of the domains of SDOH. And 3 out of 10 individuals have more than just one. So you have people that are battling financial strain, food insecurity, lack of transportation. Specifically as it relates to food insecurity, 1 in 5 households in Chicago are food insecure. That's in Chicago. On the west side of Chicago, we're hitting even harder. So I grew up on Van Buren and Pulaski. That's where I live. My brother's here today too. We live right in front, back up, it just depends on where you live. A building that has always been a grocery store as long as I can remember. And so when I was a kid, it used to be called Supergiant. It was no Supergiant. It used to be Supergiant. And now it's Save a Lot. But it has always been a grocery store. And oftentimes, my family and I talk about, well, what was it before it became Supergiant? But it has always been a grocery store. And that has always been the first place that we went to for our groceries. And so over the years, communities on the west side of Chicago have lost grocery stores like that. I think there was an Aldi's that was right up the road that closed down right during the pandemic, right before the pandemic. So it's not that many grocery stores that are left on the west side of Chicago. So community areas on the west side are hitting even harder. 21% of those individuals in Chicago are food insecure. What we know for communities on the west side of Chicago, 25, almost 26% of residents that live in 60624 are experiencing food insecurity. That same community area has a 12-year gap in life expectancy at 70 compared to those that live in the Loop at 82 years. And then overall, what we see from just our own personal data is about 37% of our patients are food insecure. So Chicago, 21% overall. Folks that live in West Garfield, East Garfield, 25% of those individuals are food insecure. And then what we're seeing in our general data, 37% of patients are food insecure. So we are seeing the most hard to reach, hard impacted patients of social drivers of health. And there's no secret in terms of what lack of access to healthy foods are associated with: hypertension, diabetes, cancer, asthma. I don't need to tell this group. We know what those impacts are. But here's the annual cost to food insecurity: $130 billion in illness to cost. $19 billion value of poor educational outcome and low lifetime earnings. $17 billion in charity contributions to address hunger. So you have all of these organizations, some of them you'll hear tonight on this panel, that are creating innovative ways to address food insecurity. And lastly, $424. That's the cost of hunger in America. And it's even higher in community areas on the west side. So here's some of our statistics about the way that we look at addressing food insecurity. We have wonderful partnerships with the Puerto Rican Cultural Center. We have partnerships with Instacart, which you're going to hear a little bit about the work that they're doing. But oftentimes what we see is that with our Instacart program, 86% of our orders are being delivered, and thus we're eliminating transportation barrier issues. Only 14% are pickup. 4 in 10 individuals are ordering basic necessities: eggs, banana, and water. Do you have a hard time buying eggs, banana, and water? So when I saw that, I said, wow, they're ordering basic necessities every month. And then lastly, 87% of our participants are repeat users. So they keep going back and back and back for these basic necessities because they do not have the financial ability to provide basic necessities in their refrigerator. So what are some of our outcomes? So we are, most of the disease states that we're looking at are the disease states that are mostly impacting these communities: diabetes, hypertension, and depression. And what we have seen so far is that 49% of our patients who were uncontrolled for diabetes when they initially came to see us became controlled at their last encounter. 59% of patients who were uncontrolled before they came to see us became controlled at their last encounter. And then 7% of patients who were uncontrolled at their initial onset of engaging with us became controlled for depression at their last encounter. This is tremendous work in a short period of time, and it speaks volumes in terms of if you remove barriers, the health outcomes that you can make. So again, I want to take the time to just really thank the individuals that are on the ground really doing this work and identifying the issues that patients are experiencing. We have a short video that we want to show, so I'm going to turn it over, if you can look at the monitors that are throughout this room so that you can see the video. Thank you. So, this work is not only just really having an impact on patients' lives, but one of the other things that we wanted to be intentional about our relationship with Instacart is that we were also having an economic benefit in the community. Because the more that we invest into local, hyper-local, super grocery stores, the ones that are going to stay here, like the Supergiant that's now turned into a different grocery store, the more they remain. And so we were very intentional about making sure that those super local grocers had access to this program where our participants can reinvest those dollars back into the community. So again, thank you, Instacart. Thank you to Sprouts the New Life. Thank you for the Puerto Rican Cultural Center for really contributing to how we think about addressing food equity on the West Side. So now I want to just bring up Representative Lilly to give a few words.
They didn't want my name tag upside down. Well, I just want to say, welcome to my hometown. This is my stomping grounds. I grew up in West Garfield. And the place that we are sitting at this moment is a place where I came when I was very young. And to learn about the importance of, I'm going to say, the earth and what it produces. So you see why folk like me stay engaged in the community. Very instrumental in the advisory council here, advisory council in the Dome, when I was in my 20s. So I came back from college, got my undergrad from Drake University, got my graduate from Oklahoma University, and ended up on the west side of Chicago, Garfield Park, investing back into the community that gave me the hope that I needed to go out in the world to gain the understanding of where I'm actually truly needed. So again, welcome to the west side. And I'm not going to say it's the best side. You can make that assessment on your own. But again, as mentioned by a number of people who are just part of the state of Illinois, I'm going to say village. We understand the needs every day as legislators and as staff, administrative staff, what you're saying and what your needs are. And to have a town hall on today that comes from listening. So yes, the Hospital Transformation Collaboratives was from a table we call the Medicaid work group, where we kept saying, no, get it wrong, we gotta figure out something else. And yes, when you have two great minds, and I'm gonna say, Senator Aquino, you're great, and you have Camille Lilly, who's committed to the west side of Chicago and the people who are needed the most throughout Illinois, we say you have to do things differently. And so this hospital transformation is bringing you all together. Something that you weren't doing very well before. And the reason why you weren't doing as well is because of the policies we put in place. So I'm not blaming you. But this opportunity to work together, to work on issues such as food insecurity together, truly it will make the difference. So I am proud of the Donald Dews of the world, and the Jose's of the world, and the Tesas of the world, and the Christies of the world. I'm just proud that you all are together. And because this room was full of people interested in what you're doing, this town hall, I think you're going to be around for a while. The support that we want to provide, meaning the state of Illinois, to these types of conversation, to this type of, the video alone tells you when you work together, you sit at the table together, you come up with great ideas. Thinking outside the box. Instacart, it just got here. And yet we're using it to create access to food. Thank you. So I take my seat. Director Whitehall and her team will continue to really be a part of the solution. Did I say her name right?
Whitehorn?
Yes, Whitehorn, Director White. She's new, so I want to make sure I get it correct. But and her team, we are here to make sure that the Health and Family Services are a part of the village. Keep doing what you're doing. We welcome your ideas. We welcome your ingenuity. And most of all, we welcome the love that you're sharing and providing to the people who need it most. Keep up the good work. God bless.
All right, so we're about to get to the meat and the potatoes of the program, and I want to invite the panelists to make their way up to the stage. There's a step over here, so you might want to come over on this side. But before, and the panelists, you guys can go ahead and take your seats as well. All right. So our moderators tonight is David Miranda, and let me just say, it is an honor to meet David. When you read their work and when you see their work, sometimes you feel a little starstruck when you see them in person. So it is an honor to really have you here today. David is a journalist and a broadcaster who got his start at age 13 for the Boys and Girls Club community radio station. Over the years, he's worked for WGN, Tribune Media, Telemundo, Univision, and other ventures. He has also advised companies on brand and media. David was born on the west side of Chicago, Little Village. I'm gonna call it the west side of Chicago. I hope you do too. Let's give him a warm welcome as he moderates our performance tonight.
All right, thank you, Mr. I know there's some people standing up. You guys can have a seat. Welcome, welcome, welcome. Have a seat. Ya no van a crecer tanto. Siéntense. Siéntense, por favor. It's great to be here today because it's my mom and my grandma would say is like you can support a lot of things. Puedes aguantar muchas cosas, pero menos el hambre. You cannot support hunger in any way, shape, or form. So that's why I'm here to be with you guys here today. Thank you so much. Well, we're excited because this discussion is definitely where everybody is part of it. Doesn't matter actually where you live here in the West Side. Doesn't matter. I like the way I heard it. Doesn't matter color. Actually, and you know what? There's a QR code that you're going to be seeing on the screens right here too. So you can use that so that you can have the Q&A a little bit as well, so you guys can ask some questions as well. I know it's being recorded as well, so this can live and this valuable information can be provided to many other people. We have a stellar panel here tonight, which is amazing as well. Each one brings a unique perspective to food insecurity, actually, and insecurity and food. I know that you all want to hear from them, so I'm going to be very, very brief here today. So I'll be quick. So first, we're going to have Tesa Anewishki. Anewishki. Oh, is that short? Yeah, Anewishki, thank you so much. She's president and CEO at Loretto Hospital, which is the landmark safety net hospital on the west side, providing health services to the community since 1923. Holy. All right, we also have Julia Bassett on the panel here. She is in the Office of Community Health Equity and Engagement at Rush University System, which has done some incredible on-the-ground research, which we will be discussing here tonight as well. James Brooks also is CEO of Lawndale Christian Health Center, which is a preeminent community health organization on the west side. Here in Ogden, right? That's in Ogden? Yes, okay. And also Amy Laboy. Okay. She's Vice President of Programs and Community Partnerships for Greater Chicago Food Depository, which is one of the largest food banks in the country. And also, now I'm going to get my R's ready right here. So we have Sarah Mastrorocco. Yes, all right. She's Vice President and General Manager of Health at Instacart. She is a leader in Instacart's food security program. And we also have Carmen Vergara, which is Vice President of Community Partnerships of Chicago, Botanic Garden, I want to go there, which is a key lead in the Ogden Farms Initiative. So let's get started because vamos a hablar de mitos y realidades. You know, sometimes you hear information, no escuchen necesariamente lo que les dice la vecina, escuchen de los expertos. I like to always say, like, don't listen to what your neighbor necessarily says, listen to the expert. So to start off this tonight, how do we define food insecurity? That's the thing, because for those of you that hear it, especially if it's being recorded, some of you probably don't even know what it means, because horror is beginning to look very different, and especially if it comes to food that's nutritious, because maybe when we start off with food, then we can not end up with medication. I'm not the expert, but that's why I want to talk to this panel here today. And not only that, and what do you see as the public's perceptions or misperceptions about food insecurity? That's another question that I have here today. What do most people misunderstand or choose to ignore about food insecurity? So how about we start off with Tesa? That would be me.
Good evening. I think one of the misperceptions is the difference between hunger and food insecurity. So hunger is a physiological condition. Food insecurity talks about lack of access to food, or to take it a little deeper is low food insecurity, the lack of access to healthy foods. So I think that's one of the differences with respect to food insecurity.
Yes, James?
I would agree, saying lack of access to quality food. I recently watched a documentary entitled "They're Trying to Kill Us," and I heard a term that I had never heard before, was food swamp. So not only in North Lawndale, where I live and work and worship, we a food desert and have insecurities to access quality food, but we have a plethora of bad choices to choose from. So that's how I look at food insecurity. not just the access to food, but a whole access to all the bad food.
Nice. So we'll continue on.
Yeah, and I'm echoing the same sentiments, but I'm gonna respond to the latter part of your question. And I believe that one of the biggest misconceptions are people think if you give a person SNAP benefits that they're good. Oh, you're good. You're not food insecure. You have SNAP benefits. You can go and shop at the grocery store, and that's one of the biggest misconceptions. We know that to be fact, just with the work that I'm doing at Rush, and I'll be able to talk a little bit about that later.
I'm going to lean into that a little bit more and just speak to the fact that, even as we heard in the video, this misconception that it's individuals who are homeless, who are living in complete poverty, which is not the case. It is those trade-off decisions of people who are working multiple jobs, and it's not earning a wage that is comparable to the living wage. And actually, the data here, the MIT living wage calculator for 2 full-time working parents with 2 children living in Chicago, they would need to earn $29.20 an hour each to be able to reach the living wage. And so there is a huge gap in terms of being able to access the food that you want and the dollars that we're earning.
Carmen?
Yeah, I would say, just like we heard on the video, working families are not eligible for benefits, but their paycheck isn't enough to really feed their family, and they're working really hard, and a lot of the distribution sites have operating hours that are in line with when they're working, and so it makes it really, really hard for them to be able to supplement in that way. And it makes me really think about the privilege of time. You know, sometimes we see families who go to this distribution site on a Monday, and then they have to go to this distribution site on a Thursday, and it's just not, they could be using that time in other more meaningful ways, but because of need and necessity, that's happening. So I think really thinking about our families who are working and are just not able to, pay for all of the food that they need, but also who can't make some of the distribution sites because of those operating hours. Something for all of us to think about.
Thank you. Now you have the microphone. Might as well continue on with you. Carmen, tell us a little bit about what the Chicago Botanic Garden is doing for equity and what everybody here can learn about it as well.
Sure. So at the Chicago Botanic Garden, our mission is to cultivate the power of plants to sustain and enrich life. And we do this by connecting people to plants. And so much of our healthy food really starts with plants, whether that's vegetables, fruits, and grains. And typically you see this produce being grown in large fields, large acreage, but at the Botanic Garden, we are really focusing on urban agriculture and building the capacity for it so that everyone, no matter where you live, can have access to locally grown, healthy produce. And so urban agriculture at Winnie City Harvest, which is the branch of the Chicago Botanic Garden, has been really operating on the west side for almost 20 years and growing food through a number of different production farms. We have 5, mostly on the south and west side of the city, that then gets either sold or donated at accessible prices at our farm in Ogden location, and through our produce prescription program called Vergara that we'll talk about a little bit more over the course of the night, but really making sure that we're having affordable produce at accessible prices for people on the west side is really our mission and our goal. And that's why we partner with federally qualified health centers like Lawndale, like PCC, because we know that they're serving some of the most vulnerable folks who are dealing with a number of social determinants of health. And if we can do the piece of bringing fresh, high-quality produce to patients that we know are recommendations that providers are making in the exam room, we feel that together through partnership, we could help patients achieve some of their health outcomes. And with FQHCs being our national safety net, we see that taking a similar approach of affordability and accessibility as a preventive strategy can be really helpful, just the way we do for primary care.
Preventing, I think, is the key before we have a more severe situation. I know that the QR code is going to be appearing on the screen, so you guys can also ask some questions in a little bit. But we're going to go on with Sarah because I really am very intrigued about how technology plays a part in this topic, and we'll dive into it a little more. But right now with Sarah, we're going to talk a little bit more about the classic consumer tech company, because I know that their headquarters are in the Bay Area, in the Bahia, ¿verdad? Yeah. First, tell us about Instacart's role in addressing food insecurity. I know we heard briefly on the video a little while ago, but how did the idea incubate about the company? About this issue especially. Basically, what is the opportunity for tech and this social issue?
Yeah, and wonderful to be here. Thank you so much for having Instacart represent, and me represent Instacart. Instacart was founded in 2012 as a grocery delivery company. I joined in 2014. And fast forward to 2020 is when COVID hit, grocery delivery became not just a luxury, but a necessity for many. And thankfully, I'm very thankful that we were there to rise to the occasion. And just one step back, if you aren't familiar, Instacart is the leading online grocery platform. We serve over 98% of U.S. households with same-day delivery of fresh groceries. So most households in America can get a fresh grocery delivered to them via Instacart. That includes 93% of food deserts, or households that live in food deserts. So we love access, and we love delivering from local. So 85,000 stores across the U.S. and Canada locally to your home. And during COVID, we found out that it really did. Overnight, people couldn't leave, and we were so happy to be able to provide that assistance. But at the same time, we were working with the USDA, Food Nutrition Service, to make sure they could use their SNAP dollars online too. So important for people to be able to have that choice and be able to pay with whatever they can, online. And so we pioneered that. We now accept EBT SNAP in over 30,000 locations in all 50 states and Washington, D.C. And what we learned, in that process, was that we were really people on a budget use Instacart in a very distinct way and are very loyal to Instacart for really 4 reasons. The first 2 are pretty obvious. I'm solving for time. We talked about it, time and transportation. I don't have reliable transportation, or I live in a food desert or food swamp. Then the other 2 were that there's a stigma of using financial assistance sometimes, and online provides that anonymity, and there's a stress of that and sticking to a budget. And online grocery actually lets you stick to a budget. There are very savvy ways to shop. You can put things out of your cart, and you might not do that at the checkout stand. There might be I can't put that back. Online, I can put everything back, right? My kid's not grabbing it off the shelf. So we're really excited about that insight, and we want to lead into that with partners. We're obviously so excited about the Wellness West program and experts from the community helping us be better. So I think as a consumer tech provider, and we are a for-profit company, we come humbly to organizations like this and say, we have this tool, let us work with you and iterate it and make sure it's working. So we're excited about the success that we've had, but we think there's so much more we can do with our platform to be infrastructure for food as medicine and these food insecurity programs.
I have a question for the people in the audience. How many of you actually use an app for groceries? Raise your hand. Okay, yeah. How many use an app for nutritious recipes? I'm very intrigued about how technology plays a part of our food, because you spoke about the pandemic right now, Sarah. And at the beginning, people were so worried about buying toilet paper. Y yo me preguntaba, ¿por qué empezaba la diarrea, la preocupación? ¿Por qué no se preocupa por comprar comida? I was worried. You should be buying nutritious food, not necessarily toilet paper. So, as you have a microphone, what have we learned about this particular topic about food security after the pandemic?
So your question is, what have we learned?
Yeah, what did the pandemic teach us about this issue?
About food and toilet paper.
People were necessarily buying that, but you should be buying food, nutritious food, not necessarily all this other stuff. It's how are you going to...
Well, I think what Misty said too, it's everybody's different, but you have to fulfill basic needs, right? There's basic needs people need to meet, and I think the other thing that we've learned, especially with access to nutritious food, and I like that you brought nutrition apps and I think Wellness West, teaching people how to eat healthy, how to cook, developing a taste for healthy food too, especially with children, what we're excited about. We do work with one of the first projects, Instacart Health, was officially launched in September of 2022. We launched with Partnership for Healthy America and their produce prescription programs. I might be getting ahead of myself on this question, but there's an example here of course you can look at stats and we help people and they retain, but when we talk to a mom and says, I don't have budget to play with food, right? I can't buy this $3 pepper and hope my kid likes it. But if you give someone an extra $50 a month, you can, in like a few recipes. So we're so excited about, I think, the next generation's palates and getting kids excited. So we think that's an example of like learning from people. People aren't just gonna like get extra money and buy brand new things and hope they like it, you know? I do think it's part of it. Obviously community-based orgs like Wellness West are playing that role too. Instacart is the tech platform. We're not everything to everyone, but I think my job is to like expand those insights and help people, you know, kind of shine the spotlight on great orgs like this to know what works, and hopefully we can keep repeating it and helping people.
Thank you, Carmen. Thank you. For those of you taking videos and pictures, please do the hashtag Wellness West Chicago. So like that, whoever is not here, they'll know what they have missed. And like that, we can create a little bit more awareness about this topic and what the organization is doing. So now let's move on with James. Oh, and also in case you have an in-depth question, we're introducing the topics right now, but we're going to have in-depth questions from you in a little bit. So James, we're going to move on with you because I know you run the legendary Lawndale Christian Health Center. Talk about the biggest issues you've seen over the years with the average person living in the community regarding food access. Also, while we're at it, tell us about your cafe veggie farm as well. And then other initiatives that you have going on at this time.
Yeah, just a little bit about Lawndale first is that we have about 75,000 patients that call us home for their primary care. That's where we have now.
75,000?
Yeah, we're up to about 735 staff. So we're an anchor institution in North Lawndale. And that has allowed us to do some creative things. Actually, this year we're celebrating 40 years of ministry. We've been there for 40 years. I think when you talk about the community, one way that I think about community, and I want to be clear, as Misty alluded to, that our brother who is here, this is our community. The Brooks family in particular, we have deep roots, came to North Lawndale in the late 50s, and my father, and I'm going somewhere with this, my father had 14 siblings, right? And all of them suffered with hypertension, living in North Lawndale. Majority of them had diabetes. My mom died because of hypertension and kidney failure. So I just want to make it real with you. And I kind of resisted being on this panel. Number one is my daughter's birthday, but number two is that when it comes to food, I need to do better myself, right? Because in my late 20s, I was diagnosed with hypertension. And because the access to the food that I had, my taste palette was different. Because I love honey buns, I love flavors, I love Doritos, right? And so now that I'm on this journey after watching this documentary, my wife and I, we said we have to change things. So I'm so grateful to be leading Lawndale Christian Health Center because I personally understand what our patients are going through. One thing I love about Lawndale is that we're proximate community health centers. We're located within the community. We're not on the outskirts. We're in the community, what gives our patients access to quality health care. Lawndale, we've been able to do some creative things because of partners like Wellness West and other partners. We've been able to start, open a Green Tomato Cafe. There were no sit-down restaurants in North Lawndale, so we opened a Green Tomato Cafe. We haven't figured out how to make money yet. But our residents, my neighbors, they have access to come and sit down and have a healthy food option to eat from. We have a fitness center where we charge $15 a month with no contract. We're in partnership with Chicago Botanic Garden at the farm on Ogden. We own the building, but the Botanic Garden, they run the operations. And then we have what we call aquaponics, where the waste from the fish nurtures the plant life all year round. And they also provide like a market for our residents to go to. So yeah, we've come a long way. Lawndale Christian Health Center has done some amazing work over the 40 years. But as Lawndale, as our community, we still have a long way to go. And I'll end on this. Health to me is not just what happens in the exam room, but health is community. And I believe that one is not fully well until your community is well. And right now, I'm not well. My community is not well. Thank you.
Nice. Don't stop shot, man. We'll work hard and go raise and make some networking as well right there from what I see. Now we're going to move on to the educated decisions portion, and that's where we're going to bring in Julia at this time. Julia, you and your team at Rush Office of Community Health, Equity, and Engagement has conducted pivotal research that's very valuable. Community health, especially in this area. Could you highlight some of the key findings that you have found in regards to food insecurity?
Absolutely. So many of you know that hospitals that have a 501c3 status, we have a responsibility to do a community health needs assessment and implementation plan. So every 3 years we go through that process, right? We're currently in that process right now. We've done about almost nearly 30 focus groups right now. We're going through the process of doing town halls and community conversations. But just remember, 3 years before that, we did that. And 3 years before that, we did that. We're hearing a lot of the same things. People are food insecure. People are hungry. People are in need of resources. And they're coming to Rush as their destination hospital and asking those very particular questions. One thing that I've noted when right around the pandemic, right around the time all these closed, it was October 17th or so, 2021, and we were doing a ton of food distributions in the community at that time. People were saying that we need access to healthy food. And so Rush, working with a lot of community-based organizations, we did just that. We came in and we brought nutritious and healthy foods to the community, but it was a Band-Aid approach, right? It was something that was kind of immediate to the folk. And as we kind of, the pandemic lifted up a little bit, we were able to start having conversations with them, people who were coming to Rush's, to their primary care physicians. And we were asking those social determinants of health questions. And we were asking those 2 food questions, very vital questions to our patients, but we didn't have a solution for it. And that was a big issue, and that was my biggest pet peeve. How are you asking folks questions and you don't have a solution for the situation? And so part of that was talking to David Miranda, who's our senior vice president. I think I saw him there earlier. And I had a conversation with him, and I said, David, I think it's really important that we have some sort of program here at Rush embedded in the hospital. And he said, well, what can you do? And so part of that was me developing the Food is Medicine and Veggie RX program for our patients. And so what that means is that a patient goes to their primary care physician and they're asked one of the 2 food questions. If they say yes to one of those questions, they're automatically deemed food insecure. So then that patient can receive a food prescription to that program, and then they, right after their appointment, they can go directly to the program after their appointment to work with a community health worker, and they then are able to get resources. And we're not just talking about shelf-stable food. We know that that's some unhealthy things. But we give them healthy recipes in order to cook those types of food. How to rinse those shelf-stable foods off. So if you have a can of vegetables, how to rinse those off and how to make them more healthier. If you have hypertension and diabetes or obesity, which we're seeing very prevalent with our patients, how you're able to cook those healthier meals. But not just that, our patients can go right to the refrigerator and pull out a 30-pound bag of produce from 40 acres. And that's really important to me because we have to make sure we're culturally relevant in that space. We have about 73% of our patients that are women, African-American women. 26% of those folks are Hispanic. And so we have to make sure that we're culturally appropriate when we're deciding on the type of produce that we're particularly picking out for our patients. And so that's really important to me. We're asking the questions, but we have a solution behind that problem. And then we're not providing patients with just that food for one time. They have the ability to get that food over the course of 3 months. But what we did notice that last November, a lot of SNAP benefits were cut. And that affected about 47% of our patients. So what did that mean? We had to, even though they graduated out of our program after 3 months, they had to be reinstated into the program, right? And so we've had to reinstate about 79 participants in our program. We currently have about 2,700 people in our program right now that are currently active, that are getting resources, that are getting support. And so just being mindful that we're asking the questions, we have a solution, and we're providing these resources to folks. And then we're also making sure that they are getting access to SNAP benefits. So if in fact they don't have SNAP, then we're setting them up with SNAP. If they need access to food, like Meals on Wheels, then we set them up for success with that. We're also working with other organizations to curate medically tailored meals, and we're also developing those programs and putting those on platforms for people to have access to it. So again, we as a hospital system, we are not just asking the questions, but we're also providing the answer and providing results as a part of that. And just to add to that, on April 22nd, we developed a Food is Medicine Emergency Department program. And so now people that are coming to our emergency department that are food insecure, they're walking away with food. And then if they, in fact, have a primary care physician, then we're rolling them right into the Food is Medicine program. So they're not walking away hungry, and they're not walking away from a program in which can support them for at least 3 to 6 months.
Nice. Next question is maybe more legit question. You guys can answer. It could be something very innovative, innovation, or an idea that the audience should know about. It can be using technology or a particular food program, or how different organizations partner together. Anything that is unique and innovative that you guys can add. Anybody can take this question. How about Sarah?
For me, it's been absolutely amazing to see what everybody's doing on the stage here. And something that we're really passionate about is making sure that food can come to a standard and funded in healthcare, right? That healthcare can pay for food, that it should be thought of as a part of medicine. And we are right now a year into a randomized controlled trial that we did with Kaiser Permanente. If you are on Medicaid and have diabetes or prediabetes, you get a prescription for Instacart, and it's $100 a month for 6 months for metabolically healthy food that works on a stipend. And we're really excited about the progress that we're seeing, and we're learning from members in this program, because I believe that can be the standard, just like you're talking about with your program. It shouldn't have to be nonprofit funded, that it can be healthcare funded. So really excited just to see that momentum.
Anybody else?
I'll build on that and take us back a step just to reflect on the pandemic question too, because I think actually a lot of innovation happened during our pandemic. And specifically what we saw was a lot of deep collaboration, which included some remarkable responses by federal safety net programs that included expanding the child tax credit, expanding SNAP benefits, launching what was summer EBT for children, the USDA, sourcing even more food from American growers to be able to get it out to communities through lots of different ways. And so illustrating that, a lot of that work and innovation that happened across sectors with those funding resources, we actually, during the pandemic, cut food insecurity for children by half. Now all that's rolled back because all of those pandemic era benefits are over, but it does provide that platform for innovation now that we continue advocating for that safety net, that we continue these innovative programs that emerged during the pandemic, because there's a lot of opportunity to really actually end hunger.
You know what? Dicen que la desesperación es la base de toda creatividad, and it's true, desperation is the base of all creativity. Anybody else wants to touch on this topic? James, you want to answer this before we move on with Tesa?
Yeah, I'm not gonna lie. Something that Misty said earlier, reduction of barriers leads to better outcomes. And during the period of COVID, reducing barriers to testing, to vaccinations, barriers to food, diapers, a number of things allowed people access at a quicker, no barrier way. And so I think being able to have our programming in a way where we're not creating red tape for access, I think is really something that we can learn from the pandemic.
Thank you so much. Now we'll move on with Tesa. Explain a little bit about the role of hospitals within the community. Share how Loretto is approaching food insecurity on the west side, and a little bit about what is the unique contribution hospitals play on this issue of food insecurity?
Absolutely. So much like Rush is doing. Next week, we'll actually be celebrating the 1-year anniversary of our community cover. We launched that October 16th of last year as our efforts to address food insecurity among our patients. And we started it as a pantry. And so we did a big thing. We filled it up with dried boxes of spaghetti and noodles and canned goods and so on and so forth. And as the day went by the end of the day, the food was gone. And then when individuals came in, we recognized that we not necessarily missed the mark, but based on our patient population, we serve a tremendous amount of people who are at risk or homeless, that they were looking for a meal now. So there was nothing that they could do with our dried pasta and cans that they needed a can of. They couldn't do anything with that. So within less than 48 hours, we pivoted. And we now serve about 50 single-serve meals every single day. It is contained with meals that you can eat on the spot. They don't necessarily need to be heated up. But we are also partnering with the Chicago Food Depository, and we are doing the first hospital-based free grocery store in the country. It will actually be housed in the hospital. It will be for our patients. We learned last week that we were planning on all of these fundraising initiatives on how we generate funds to support it. And they told us, in fact, they're giving us 10 pallets of food every 2 weeks. And so that cost went out the door. So we were very grateful for that. But in addition to not both, we will have both the community cover, which is accessible 24/7. No questions asked. If you're hungry, you are able to eat on the spot. But throughout the grocery store, we'll also do some food education. Because we recognize that it's not just about access to food, it's about eating healthy. We saw the stats early from the Wellness List from our presentation about how food insecurity impacts health outcomes. And so we feel that it is important that hospitals do their part in terms of educating their patients and the community on the importance of eating healthy and living longer. And so I think it's important that all hospitals begin to take on that kind of effort to address the insecurity in our communities.
And on the topic of food, we're going to go on with the Chicago Food Depository. Because I know that one of the great Chicago Food Depository's principle is, and I want to butcher this, is healthy communities start with food. All right, well, tell us about this idea and what are you most proud of as far as your work?
So we believe that food is a basic human right, and I dare anyone to challenge that. Honestly, what we really need to be working toward is equitable access to culturally affirming, nutritious food. Imagine a world where there is no child going without breakfast. That breakfast fuels them to study and have a successful day at school. Imagine a world where anyone can walk into a local grocery store and buy the products that they want. Imagine an older adult getting the nutritious meal that they need so they're worrying less and having a great quality of life. And so just recognizing that food is so core and it is a basic human right. In terms of work that I'm proud of, if we're going to end hunger, and our mission is to end hunger, we need to make sure that folks have access to food today and that we're leveraging the safety net. But if we are going to end hunger together, it really is about having important conversations about thriving wage and economic development. And us as an organization starting to be able to really demonstrate what that means and doing some of the same work that you've heard from this great panel of colleagues on the stage, where we're investing in community, where we are, as we think of food responses that need to show up in community, we're also using our dollars to source from community, that we're supporting urban ag, that we are the voices of advocacy to ensure that communities have the pathways to thriving wage and economic development.
Thank you. Y nos estamos viendo que la canasta básica está incrementando con esto de la inflación. Yo sé que ahora el huevo, la leche, el pan está incrementando de precio. I know you guys, I have a few questions already. I'm just going to line up a little bit. Yeah, go right ahead, James. Go right ahead.
I just want to highlight something. Speaking of the Chicago Food Depository, so I'm a pastor as well in North Lawndale at Harmony Church, and we have a food pantry. Every Wednesday, we service about 400 families. And what's neat, what's happening right in front of our eyes, the Rush Hospital, their cardiovascular team, they bring a group of med students to our pantry every Wednesday. And those participants in our pantry have access to go and get their vitals done. And then once the vitals are taken, if they have hypertension, high blood pressure, or whatever, then we can also make a referral to Lawndale Christian Health Center, right? So it's the church, it's the hospital, it's the community health center. And then we can point them across the street over to our market at the farm on Ogden. So it's all of these organizations working together. And I'm a firm believer that we are better together. And all these resources we have up here, we can have an impact on ending hunger if we just work together.
All right, well, this goes for all of you as well. Tell us a little bit about the impact you've seen with food insecurity and the community, a specific case that you guys would like to share with us here today.
Well, I can chime in because I think one of the things I think we focus on with the mission-driven work that we're doing now as a community, we're focused on the outside of the walls. What we learned when we launched our pantry was there were people inside our four walls that were food insecure and dealing with that. And so first, we've got to help those that are on our team as well as help the community as well. So I don't think that we can don't ignore that fact. Sometimes we're so focused on what we're doing that we miss what's right in front of us. So I think it's important that we do that as well. So that we recognize that with a couple of our team members, and we were able to give them some support from the hospital.
Anybody else a specific example that you've encountered?
No, I want to just echo the same sentiments. We actually did the same thing, so I appreciate you bringing that up. Especially during the pandemic, what happened is a lot of our families, they went to one working household. So, and then you had children home the entire time, so you have to cook breakfast, lunch, dinner, plus a snack. And so we were seeing that being more prevalent with our employees. And then when the pandemic lifted, we still were having the same problem. And so we had a lot of employees that were coming to the pantry saying like they needed support. And not that they didn't have a primary care physician at Rush, but they were just saying like, can I just get a couple things off the shelf? Like I just gotta make it to my paycheck. I just gotta make it to my paycheck. And for me, it was just like, do what you need to do. Come on in here and shop and get what you need off the shelf so that you can help yourself and your family. And that's really important. We want to take care of who's taking care of our patients inside the house first, right? That's really important. So I appreciate you bringing that up, Tesa.
Yep. All right. So we're going to move on with your questions as well. They're basically all anonymous. Some of them do have a name, but we're going to start out with the first one, which is anonymous, and you guys can continue on with the question. So this question says, we saw the value of community health workers in addressing inequities and food insecurity. How embedded are they in these organizations?
I can start that one. So our community health workers, we have about 47 community health workers at Rush. They're deeply embedded in our community health equity and engagement department, as well as our social work and community health department. And so for me particularly, I have 4 CHWs that support the food as medicine work. And then we have a few more that are doing home visits. And then we have a couple that are doing Rush at Home. And so they're doing, again, home visits. And then we have some in social work and community health. I feel like there may be a couple that are here in this space that are doing incredible work. So we have about 47 that are, singing here. So we have about 47 that are deeply embedded at Rush. And they're really doing the boots on the ground work.
And we have 2 community health workers who are part of our partner's prescription program, the GRX. And their role is primarily to encourage folks to come in to pick up their produce boxes. They get feedback from participants on what they want to see as part of the distribution for that week. They are the ones creating recipes that are part of what the distribution is going to be. It's culturally relevant. They're doing engagement on social media through Facebook with participants of the program. There's a lot of participants who will go onto our Facebook page and they'll post what they created, what they transformed with the yummy produce in the boxes. And that's the work of our community health workers who really know our participants. They look forward to seeing them every week, and they help to have that back and forth relationship between they really are doing the community health work that is what their role actually is. So I'm really happy to have them be part of our team. They're of course also bilingual, and so our participants feel very comfortable asking questions without shyness, and we think that they're a pivotal part of the team. They also work really closely with nutrition students that we have at the partnership through UIC, and not all of those nutrition students are bilingual or from the community, so the community health workers are the ones that are building that relationship between the participants and their nutritionists so that there's a good cohesive program. So they're definitely a key part of our program.
We're continuing on with Wellness West Chicago hashtag Wellness West Chicago. Wellness West Chicago. Continuing on with Greer, thank you so much for your question. Is the term food desert still the correct way to refer to an area that is facing food scarcity?
Yes. So you have either the food desert or the food swamp. So you either have no grocery stores nearby, or you have a lot of the mom and pop stores who don't have fresh fruits and vegetables or food that is appropriate for daily.
Okay, so yes, it is in fact. Okay, so another anonymous question, and it says, have you guys considered increasing, it changed me today, it's a live show, okay? What does a secure and sustainable food system look like? Thank you so much. The questions are flying, and thank you so much. It's a definitely productive topic. Alrighty, what does a secure and sustainable food system look like?
That's
yes.
That's a beautiful world. I think I gave nod to it in my earlier remarks that it is a place where everyone has the access to the food that they need to thrive, and that it does include the full ecosystem of retail, of the urban gardens, of what is the safety net programs that are the financial programs like SNAP. So it is that whole ecosystem working together. It's addressing issues of food waste. It is a very complex web that we are all a part of.
And I just think that if we all work in collaboration together, that's what sustainability looks like. Us working all collectively together, whether we're community-based organizations, we're a food bank, we're a hospital system, we collectively need to be working together to make this a sustainable, ecosystem.
Okay, the next question comes in, and it looks like it's for Sarah. In the elevator pitch answer, have you guys considered increasing the minimum order value from $75 to at least $100 on Instacart due to the high cost of living, taxes, and fees?
Is that referring to the Wellness West monthly stipend? Instacart sees itself as the infrastructure for these programs. When we work with Wellness West and their budget and what they think is a meaningful process, but we love to consult with them on what's the right monthly, for family, for individual. Instacart sees, I'm a technology expert, I said this, consumer technology, a grocery stipend, and then we work really closely with our community partners on the amounts and their budgets and the members. So we are always open to learning and improving in the program. It's not my program, it's Wellness West program, and we come as the technology partner.
Yes, so we said elevator pitch. Thank you so much for that. Now, Stephanie C. Thank you so much for your question. The question is, do any of you connect with urban farmers, especially on the west side? If so, how are you able to support their efforts within their communities? Urban farmers, local farmers, I would say, right?
Sure, I could take this question. Well, I'll explain a little bit more about Windy City Harvest. We operate 10 farms and gardens in Chicago, and the folks who are helping us to seed, nurture, and harvest our produce are folks from our job training program. It's a 9-month program, workforce development, with mostly folks who have been previously involved in the justice system, and they're learning about urban agriculture and farming. Once they're done with their training, we connect them to employment opportunities once the training is complete. And typically they find roles in other urban farms all across Chicago. They can also find roles in restaurants, in grocery stores, because part of our training allows them to learn about safe handling of food. And so as a relatively new person to the urban agriculture world, my background is in healthcare, I've been visiting a number of farms in the Chicagoland area, and I've been amazed at how many workers were trained and graduates of the Windy City Harvest program. Again, Windy City Harvest has been operating for 20 years, and so part of our role really is to build that capacity, do that training, and really allow for more folks to be able to grow, not just to be part of their employment, but even in their homes. We know that a lot of people want to eat fresh grown foods, and so sometimes the trainees are also even doing in their own homes are growing food. And so our role is really to continue training and to promoting the work of urban agriculture, because we believe that everybody, no matter where you live, should have access to locally grown foods, and really keeping everything at a reasonable price. We know that prices are really important to families on the west side and the south side, and so for us, we want to make sure that we're continuing to build that capacity.
I'd like to jump in on that one too. And as a food bank of Cook County, one of our commitments is, of course, ensuring ample fresh produce to the individuals we seek to serve. As a part of that strategy, we do have a hyper-local purchasing program in which we are literally identifying local growers and using them to source the grocery emergency food pantries in their community. And so that is one of those intentional strategies where we know we can invest dollars in community and toward thriving wage while also being responsive in the emergency food system.
All right, thank you so much. You know, there's a lot of questions happening right here, and I specifically spoke to Mike about if this is going to live somewhere. If you guys want more information, obviously not tonight, but at wellnesswest.org, you're going to be able to find more information about this, possibly the video. And the next questions that we're getting, for example, about how can smaller organizations get funding and stuff like that. If you guys want to contact the panel here today, you guys can do it directly, if not through wellnesswest.org, or send me a social media message, David Miranda Chicago, and I'll hook you guys up so you guys can stay. It's about networking. You guys are here, so just also shoot me a message, David Miranda Chicago. Misty, I think we're limited time here on the video, right? Thank you so much. Let's hear it for the panelists.
I want to thank David and the panel today for your this great discussion. I just wanted to reiterate just a couple of things that I heard. So one of the statements that I heard that was really so profound to me is that if you ask the question, you got to provide an answer. And I think sometimes in medicine, we want to know everything about the patient, and oftentimes there are questions that, as a patient, you're sitting there and you're just like, why are they asking me this question? My 95-year-old grandmother was in the hospital about a month ago, and the doctor came in and said, what's your name and date of birth? And she says, well, don't you know it? It's in the chart. Why are you asking me? She's 95. Then I think he said, like, what's today's date? And she was like, why are you asking me? You know that. So it's important to be able to have the answer and not just ask the question because you want to fill your research or you want to fill your chart. And so I think that's very important. So thank you for saying that. No patient should walk out hungry. If we're interacting with them in the exam room, and if there are signs of hunger, that they shouldn't walk out. That food becomes a standard of medicine. Thank you, Sarah, for saying that. I resisted this panel. He did. He did. And when the team told me he resisted, I think somebody said, "You need to get James." So then I texted him and I was like, "Why are you resisting?" And he said, "I don't know how much I can contribute to this." Well, let me tell you what you contributed, James. One of the things that I thought was just so profound is the way that partners work together to really innovate to solve a solution. So thank you for being here. And then the other thing that I heard is that a lot of opportunities to innovate around hunger, and that community covers, there's no questions asked. Can you imagine walking into a hospital and it's a grocery store in the hospital? I mean, just think about that for a second. Thank you, Tesa. The interesting thing about her community cover that I don't think she realized, when I was at her hospital about 2 months ago, she was talking about the community cover program. We went into a meeting, and then as I was walking out, was this young boy that came in, and he grabbed a bag of groceries off the shelf for me. And that's the power that you guys are, the change that you guys are making in your community. So we're thankful. So thank you guys really for taking the opportunity to be here today. And so there's just a couple of things. Fun doesn't continue, so you guys can stay around. You can come up and talk to the panel if you choose to tonight. And then there's also additional that you can have in the background. And then if you choose to, and if you haven't toured this beautiful gym that we're so grateful to have on the West Side, please take the opportunity to tour it. We have about 30 minutes left in this building, so it's open for you to tour the space. So again, thank you for being here today. I want to thank the panel, and I want to thank everybody that spoke here today. So good evening.